hope you all are doing great. So, this COVID is all about fighters and survivors, and we all who are watching this video are one of them. Yippee! This dreaded disease brought out the best in us.
We are shooting this video telling you the pre-prep required to get your first and second jab. Yes, it's vaccine time and you have lots of questions and I have here few answered.
We have compiled the data from dependable sites like WHO, UNICEF, etc. And we will be also breaking some myths about the vaccine in the next video which follows. So let's shoot. Prep for the COVID-19 jab or vaccine. If you're suffering from any pre-existing diseases, don't forget to take a green signal from your physician before.
Don't preload yourself with any medications.
It is advised to not take alcohol 24 hours prior to the vaccination.
Don't exercise strenuously before the vaccine.
Get a good night's sleep before vaccination. Do your research.
Learn more about the different types of COVID-19 vaccines and how they work.
Make sure you're relying on an accurate vaccine information by checking that it comes from a trustworthy source.
Cross-check vaccine information that you find online.
If you have any doubts, talk to the staff at your nearest health facility or a health worker.
Prepare your things. Make sure you have a mask that covers your nose and mouth and fits tightly and comfortably, a hand sanitizer, the notification you received about your appointment, your ID card, a travel plan to get your appointment on time. Wear loose or short sleeves that can be rolled up easily so that the health worker have easy access to your arm. Don't forget to take your own pen for filling or signing the documents. Don't forget to carry your own water bottle or light snack in case there are any long queues. Tell your health provider or vaccinator if you have any health issues or are taking any medication, including any painkillers. Cancel all your appointments if you have COVID 19 or the symptoms. If you have COVID 19 or the symptoms on the day of the vaccination appointment, do not go to the appointment. This is because you could spread the virus to the others at the vaccination center. Get in touch with your vaccination center by message, phone, or email to let them know you will not be attending your appointment because you have COVID 19 symptoms.
At the vaccination center,
When waiting in line outside of vaccination center and once you are inside.
keep your mask on at all times.
Don't touch your mask when it's on.
Keep at least 1 meter distance.
Sanitize or wash your hands after touching.
Don't touch your face.
During vaccination, all COVID 19 vaccines, regardless of the manufacturer, are administered in the same way. The vaccine will be injected in the muscle in your upper arm. It should take no longer than a few minutes and may cause a little pain. Keep your mask on during your appointment. Turn your face away from the vaccinator to keep safe both of you. If you are feeling nervous or anxious, remember that it's just a small prick that could save your life. Take slow deep breaths, look away from the needle.
After being vaccinated,
Some side effects are normal and expected. Side effects are sign of the body to building immune protection.
common side effects are
Some pain, swelling and redness on the arm where you received the vaccine.
chills or mild fever,
Tiredness,
headaches.
joint pain or muscle ache.
These side effects typically go away within a few days. What should you expect after getting a COVID 19 vaccine?
Stay at the vaccination center for the observation period.
After being vaccinated, you'll need to stay in the observation area for 15 to 30 minutes.
This is to monitor your reaction to the vaccine and make sure you don't experience any severe side effects.
Don't forget to ask about the vaccination certificate. Severe side effects are very rare but could include
Itching,
fainting,
vomiting,
severe allergic reaction.
wheezing, difficulties in breathing, and shortness of breath.
Let a health worker know immediately if you experience any of these side effects.
Severe side effects, while very rare, are most unlikely to appear in the first 30 minutes after being vaccinated. Your stay in the observation area means qualified help is on hand in the unlikely event that you do if you experience any.
Prepare for your second vaccination appointment.
Most COVID-19 vaccine needs two doses to work. This means you need to be vaccinated twice with a gap of 4 to 12 weeks between the first and the second dose.
It's important that you get your second dose even if you experience side effects from the first. unless a vaccination provider or a doctor tells you not to get the second dose. When you get home,
take care of yourself.
if you experience any side effects, these may affect your ability to do daily activities for a few days.
Some people may develop fever, muscle pain, and swelling, redness, pain, or tingling sensation at the site of injection for 1 to 2 days. Make sure you're drinking plenty of fluids.
You can take some personal paracetamol to help ease any of these sensations. If you do, make sure you follow the dosage instructions from a pharmacist or provider.
If your symptoms are more severe or last longer than a week, tell the health workers who gave you the vaccine.
Care for the arm where your vaccine was injected.
You can reduce any pain or discomfort in the arm where you got the vaccine by applying a cool, clean, and wet washcloths over the area.
As mentioned, most COVID 19 vaccines require two doses to work. It takes time for your body to build protection, and you may not be protected from the virus until the 2 weeks after your second vaccination.
It can be several weeks or more between the first and the second appointment, so it's important that you don't forget.
Keep up the preventive behavior.
It's important that you continue to follow preventive measures after being vaccinated.
This is because COVID 19 vaccines have proven effective at stopping people developing the virus.
But we don't yet know whether they prevent people or passing the infection on to others.
Continue to protect yourself and others by
Washing your hands with soap and water for minimum 20 seconds or sanitize your hands often.
keeping at least 1 meter distance between yourself and others,
Meeting people in well ventilated or outdoor spaces.
wearing a mask when you can't keep a distance from others or are inside a public space.
This is especially important until 2 weeks after your second vaccination, as the during period your body still is building protection against the virus.
Share and celebrate.
Being vaccinated is a huge moment and a huge relief. Enjoy!
Talk to others about your experience.
Encourage others and get vaccinated and talk about the process, how it may feel. So tell your friends to get a vaccine immediately. Thank you guys for watching the video and share this as much as you can. One share can help someone. So peace out. Bye bye. And don't forget to like the video and subscribe to the channel. We are blasting bros.
Show some love.
We are blasting bros. Show some love. Come on, everybody. We are blasting bros.